Well, we certainly think it's an important topic to tackle here on Great Day SA. The fact is that millions of people are depressed and don't even know it. Could you be one of them? Well, there's no need to suffer in silence this morning. Dr. Harry Croft is here. He is talking about depression and treatments. Dr. Croft, thank you for being here.
Thanks for having me.
We saw Janet Jackson at the top of the show kind of reveal to Piers Morgan really unabashedly about how depressed she had been for a long time. Let's first of all define the difference between depression and just sadness.
So sadness is just a part of human living.
Yeah.
We all get sad. Things happen situationally. Usually we get over it in a short period of time. It doesn't interfere with our life. Depression, on the other hand, is a serious medical illness that lasts for weeks to months and causes us to have difficulty living our lives, interacting with people, doing our jobs, going to work, doing our housework, feeling like we have energy. And tragically, in about 1 out of 7, there's suicide.
Yeah. I've got to ask you, too, when you talk about suicide, that's a severe case of depression. You know, you talk about mild depression versus severe. Is any kind of depression healthy ever?
No.
Never.
No.
So
depression is an illness, which means it causes suffering or interferes with your life, and it meets certain criteria. It lasts longer than 2 weeks, is never normal, and should never be accepted as normal. And I'll tell you what happens in our studies. We often see this. We ask people, so how long have you been depressed? Well, a month, a year, several years. And then when they start feeling better, Bridget, they realize, you know, I've been this way for years.
Right. They have depression and don't even know that's what it is.
And so what happens is, over time, they begin to accept being depressed as being normal for them and reset their expectations. And they come into us only when they're horribly, horribly depressed, because being normally, quote-unquote, depressed has seemed normal to them. It's never normal.
It's never normal. Well, we have actually, we have some questions from some viewers, and Eileen is in our Cyber Cafe with a couple of questions from some viewers. Eileen, good morning again.
Good morning again. Now, Doctor, we've got some chatters who want to know some of these questions, and that is from Nettie. Can depression be treated without medication?
Oh.
Yes. In fact, in mild to moderate depression, that's probably the treatment of choice, psychotherapy, the talking therapy. Now, in addition to that, exercising, eating right, and in some cases even nutritional supplements may be helpful. But in moderate to severe depression, probably medication is where you ought to start, and then you can add psychotherapy if you want. But the psychotherapy has to be a special kind of psychotherapy, just not talking about whatever's on your mind. It has to be a special therapy called cognitive behavioral or interpersonal therapy, and most therapists know exactly how to do that.
And one of the things to point out, Dr. Croft, for sure, is that it's nothing to be ashamed about. Is it likely that if you have depression and you are treated for it, that it will come back again at some point in your life? Are you more susceptible to it?
It can, and certain people probably are. What we know for sure is if you've had depression at least 3 times in your life, your chances of having it again are probably greater than 90%.
Let's see if we have another question, Eileen.
Okay. Here's another question. What can you do about a teenager who is depressed all the time?
A teenager, which is already a rocky stage, Dr. Croft, and add depression to it, you've got a problem, right? You've got a problem.
So teenage years are very difficult in a lot of ways. Teens are finding out who they are. They're looking for new friends. They're trying to break away from their parents. And often what looks like clinical depression is actually part of the normal growing up experience. So you have to take the teenager to somebody that knows what they're doing, that can try to figure it out.
Dr. Croft, well, we certainly appreciate all of that insight. Certainly get help. Don't suffer in silence, whether you are an adult or a teenager.
And we're looking for people for our study. People with depression, call us,
Win-win situation. Dr. Croft, thank you. Eileen, thank you for those questions as well.